Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Gastrointestinal bleeding. Introduction. Gastrointestinal bleeding is a symptom of many diseases rather than a disease itself. A number of different conditions can cause gastrointestinal bleeding. Some causes of bleeding may be life-threatening, but most conditions can be healed or managed. Finding the source of the bleeding is important. Knowing if the bleeding is coming from the upper or lower digestive tracts can help your healthcare provider make a diagnosis. This program will help you understand gastrointestinal bleeding. It discusses the symptoms and causes, diagnosis, and treatment of gastrointestinal bleeding. The digestive system. The digestive system is also known as the gastrointestinal system. Swallowed food passes through the esophagus, also known as the feeding tube, then through the stomach where it is partially digested. Digested food travels from the stomach to the small intestines, where nutrients are further digested and absorbed. The small intestines are divided into three parts: the duodenum, the jejunum, and the ileum. Digested food that has not been absorbed in the small intestines reaches the colon or the large intestines. In the colon, the remaining nutrients get absorbed and stools are formed. Stools are then stored in the last section of the colon between the sigmoid and the rectum before being excreted. The colon is made up of the following parts: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus. The gastrointestinal system is also called the GI tract. It is sometimes divided into two parts, the upper GI tract and the lower GI tract. The upper GI tract includes the mouth, esophagus, stomach, and duodenum. The lower GI tract includes the rest of the small intestines, large intestines, and anus. Symptoms. The symptoms of gastrointestinal bleeding depend on the site of the bleeding and how bad the bleed is. Signs of bleeding in the upper digestive tract include traces of blood in the vomit or stool. The vomit may include bright red blood spots or may look like coffee grounds. Signs of GI bleeding in the stool include black stool, stool that looks like tar, dark blood mixed with stool, stool mixed or coated with bright red blood. Signs of bleeding in the lower digestive tract show up in the stool but not in the vomit. Sudden severe bleeding is called acute bleeding. Acute bleeding is often accompanied by abdominal cramping, diarrhea, dizziness or faintness. Other symptoms that often happen with acute bleeding include paleness, shortness of breath, weakness. Acute bleeding is a medical emergency. A person with acute bleeding should call for an ambulance or contact a healthcare provider right away. Bleeding that continues for a long time is known as chronic bleeding. It is usually light bleeding and starts and stops from time to time. A person with chronic bleeding may experience tiredness and shortness of breath. Both chronic and acute blood loss can lead to anemia. Another type of bleeding is called occult bleeding. This is a small amount of bleeding and may not be noticeable by the naked eye. Simple tests can detect occult blood in the stool. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. A variety of conditions may cause bleeding in the digestive tract. First, we will look at some causes of bleeding in the upper digestive tract. Peptic ulcers are a break in the lining of the lower part of the esophagus, stomach, or upper part of the small intestine that may cause bleeding. They may be caused by bacterial infections and long-term use of non-steroidal anti-inflammatory drugs, such as aspirin and ibuprofen. Enlarged veins that are located at the lower end of the esophagus are called esophageal varices. These varices may burst and bleed a lot. Liver cirrhosis is the most common cause of esophageal varices. Tears that happen in the esophagus can also cause upper digestive tract bleeding. These are called Mallory-Weiss tears. They are usually caused by vomiting. Other causes of Mallory-Weiss tears are coughing, hiatal hernia, or childbirth. Inflammation in the lining of the stomach may cause bleeding. It is known as gastritis. NSAIDs, infections, and certain medical conditions can cause gastritis. Bleeding may also be caused by esophagitis. Esophagitis is inflammation of the esophagus. It is most often caused by esophageal reflux, also known as GERD. Upper digestive tract bleeding may also be caused by tumors in the esophagus, stomach, or duodenum. Tumors are abnormal tissue growth that may or may not be cancerous. Non-cancerous tumors are called benign tumors. Unlike malignant tumors, benign tumors do not spread to other parts of the body. Now we will look at some causes of bleeding in the lower digestive tract. Diverticular disease is one cause. This disease is caused by pouches in the colon wall. These pouches are called diverticula. Colitis may also cause lower digestive tract bleeding. Colitis is an inflammation of the colon. It may be caused by infections, Crohn's disease, lack of blood flow to the colon, radiation, and other diseases of the colon. Lower digestive tract bleeding may also be caused by hemorrhoids or fissures. Hemorrhoids are enlarged veins in the anus or rectum. These veins can rupture and bleed. Fissures or ulcers are cuts or tears in the anal area. Abnormalities in the blood vessels of the intestine can be a cause of lower digestive tract bleeding. These abnormalities are known as angiodysplasia and are caused by aging. Lower digestive tract bleeding may also be caused by polyps in the colon. Polyps are abnormal growths that may or may not be cancerous. Colorectal cancer is a common type of cancer that often causes mild bleeding that is not noticeable by the naked eye. Diagnosis. The first thing your healthcare provider will want to figure out is whether the bleeding is coming from the upper or lower digestive tract. He or she will ask you about your symptoms and perform a physical exam. Sometimes certain foods can make your stool look like there is bleeding. Deep red foods like tomatoes and beets, as well as dark juices that contain red dye, may have this effect. Your healthcare provider may also ask for a stool sample to confirm there is bleeding. Stool tests can also show bleeding that is not visible. A blood test can also help diagnose gastrointestinal bleeding. This can tell your healthcare provider the extent of the bleeding. It also shows if you are anemic due to bleeding. Nasogastric lavage is another test that may help determine the source of bleeding. A tube is inserted through the nose and into the stomach for this test. The contents of the stomach are removed and tested for blood. An endoscopy is the most common test for diagnosing gastrointestinal bleeding. During an upper GI endoscopy, a thin, lighted tube called an endoscope is inserted through the mouth. It examines the esophagus, stomach, and duodenum. A colonoscopy also uses an endoscope. For this procedure, the endoscope is inserted through the rectum. This way, the colon can be examined. This is known as lower GI endoscopy or colonoscopy. A biopsy may be done during either an upper GI endoscopy or a colonoscopy. A biopsy is a removal of cells or tissue. The sample is then examined under a microscope. An enteroscopy examines the small intestines for signs of bleeding. Special endoscopes are used for enteroscopy. This is because traditional endoscopes are not long enough to reach the small intestines. There are 3 different types of enteroscopy: push enteroscopy, double balloon enteroscopy, and capsule enteroscopy. Barium X-rays may also be used to diagnose the cause of gastrointestinal bleeding. Liquid containing barium is either swallowed or inserted into the rectum for this test. The barium makes the digestive tract visible in the X-rays. Another test used to find gastrointestinal bleeding is radionuclide scanning. This test requires injecting a small and safe amount of radioactive material into your vein. A special camera creates images of the blood flow in the digestive tract. It can detect slow bleeding. An angiography may also help detect the exact source of bleeding. An angiography uses a dye injected into your blood vessels. The dye makes blood vessels visible in X-ray or CT scans. An exploratory laparotomy may be done if other tests can't find the source of the bleeding. An exploratory laparotomy is a surgical procedure that examines the digestive tract. Treatment. Treatment of gastrointestinal bleeding depends on the cause of the bleeding. Gastrointestinal bleeding is a symptom and not a disease or medical condition. During an endoscopy, your healthcare provider may be able to stop a discovered gastrointestinal bleeding. He or she can insert tools through the endoscope to inject chemicals into the bleeding site, treat the bleeding site with a heat probe, electric current, or laser, close affected blood vessels with a band or clip. If an endoscopy doesn't work, an angiography may be used to inject medicine or other materials. This may control some types of bleeding. Surgery or other treatments may be needed to stop the bleeding. To prevent bleeding in the future, healthcare providers treat the disease or medical conditions that cause bleeding. Diseases that can be treated include H. pylori and other infections, GERD, ulcers. Other diseases that can be treated include hemorrhoids, polyps, inflammatory bowel disease. You can also prevent future bleeding by limiting your use of non-steroidal anti-inflammatory drugs, managing your GERD symptoms, if you have GERD, using alcohol moderately, and stopping smoking, if you smoke. If the bleeding is caused by cancer, then surgery is needed to treat the cancer and stop the bleeding. If you are severely anemic, blood transfusions may be needed. When bleeding is caused by inflammation of the lining of the intestines, medications are given to decrease the inflammation. At times, the source of bleeding is not discovered. This is especially true in slow bleeders. Patients with such a condition have to be followed up closely by their healthcare providers. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Gastrointestinal bleeding is a symptom of many diseases rather than a disease itself. A number of different conditions can cause gastrointestinal bleeding. The symptoms of gastrointestinal bleeding depend on the site of the bleeding and how bad the bleed is. Signs of bleeding in the upper digestive tract include traces of blood in the vomit or stool. The vomit may include bright red blood spots or may look like coffee grounds. Signs of GI bleeding in the stool include black stool, stool that looks like tar, dark blood mixed with stool, stool mixed or coated with bright red blood. A variety of conditions may cause bleeding in the digestive tract. Treatment of gastrointestinal bleeding depends on the cause of the bleeding. Gastrointestinal bleeding is a symptom and not a disease or medical condition. During an endoscopy, your healthcare provider may be able to stop a discovered gastrointestinal bleeding. He or she can insert tools through the endoscope to inject chemicals into the bleeding site, treat the bleeding site with a heat probe, electric current, or laser, close affected blood vessels with a band or clip. If an endoscopy doesn't work, an angiography may be used to inject medicine or other materials. This may control some types of bleeding. Surgery or other treatments may be needed to stop the bleeding. Thank you for using Explain.